Welcome to the Function and Strength Speed and Power podcast. I'm Jason Fairheller, and along with Ryan Heichert, we're going to talk about all things strength and conditioning related to improving on-field speed and power for your athletes. Along with our own unique ideas, we will be bringing you professionals in the field to talk about their own skill set to get athletes faster. All right, so we have Trevor Rappa here. Trevor, welcome to the Speed and Power podcast.
Thanks for having me on, guys. I really appreciate it.
So I wanted to bring you on particularly because you're a performance coach, but you're also a physical therapist. So the first thing I wanted to kind of get into was how having that background in performance has an effect on what you do on the therapy side of things.
So I'm pretty fortunate with my other two business partners. Like, we all were strength coaches prior to going to PT school. And I think that's made a profound impact on just our treatment style in general. So we kind of know when people have a goal, we know like the end stage to get to any goal is typically something kind of more on the training end of the spectrum rather than towards the rehab end of the spectrum. And I think for us, we kind of have the skill set to be able, from our PT background and the performance background, to take somebody from an acute post-op case to getting them back on the field. So kind of being able to run that whole spectrum from the first day post-op surgery to getting them actually back on the field and being competitive in their sport has really been huge for us. And even not even just with athletes, but with some of the Gen Pop people that we see, like, you know, fitness is so huge for everybody, whether they're dealing with an injury or not. So we know how to safely coach and safely progress and safely program for people that are dealing with various aches and pains. So I think it's been huge for us in terms of kind of separating us from some of the other, you know, more traditional physical therapists that are out there, and people really are kind of seeking more of the performance end of things. Because if somebody's goal is just to be able to walk a flight of stairs without pain, that's great. But most of the people we see have some sort of higher level activity that they're shooting for, whether it's, you know, being a weekend warrior and playing tennis or playing pickup basketball with their kids or something like that. So it's really just helped us understand how we can take people from where they currently are and get them to their goal safely.
That's great. So I wonder, like, when you guys are getting a new patient and you're kind of discussing things, like, when do the PT goals end and the performance goals begin? And I'm sure they blend and they kind of meld together. I just wonder, like, how you guys might talk through that, you know, like you're saying with your other business partners, as you're maybe seeing certain cases, ACLs and different things like that.
I honestly don't myself, and I can't speak for them, but I don't really see a difference oftentimes between the two, because typically people come to physical therapy because they have some sort of impairment or some sort of pain or some sort of limitation that they're dealing with that's stopping them from doing what they want to be able to do. And if that goal is performance related, like they want to be able to, you know, do a 5K without pain, they want to be able to, like I said, go play tennis without pain, whatever it is, it's kind of the same thing. That's performance and it's rehab. Like there's no real separation between the two. Like, they're coming to physical therapy because of what they're dealing with, but ultimately we need to give them some sort of intervention, and that's going to help them achieve their goal, even if it is more quote unquote performance-y, like those examples I just gave. But for us, it's kind of trying to take a look at, like, is there actually something going on from a dysfunction standpoint that's not letting them do what they want to be able to do, or are they just like not fit enough to be able to go and do what they want to do? Like, a good example of that is I had somebody who was a couple years ago. He was an older guy, kind of middle-aged, and he's like, every 6 months I start playing tennis again and I pull my calf, and then I stop for 6 months and then I go play tennis again and then I pull my calf, and it's been going on for like 6 years. And I'm like, okay, that's great. And it's like, nothing's wrong with your calf, you just don't do anything that is even close to the stress you're going to encounter in tennis. So our sessions were like low-level plyometrics and then progressing plyometrics and then doing some easy change of direction stuff, like nothing super high level, but just getting him more used to the stress that he's going to be encountering when he actually goes and plays tennis. So he came to me with, you know, a pain or a dysfunction or an impairment, but his goal was definitely more performance related. It wasn't like, I want to be able to go and, you know, walk up the stairs without pain. He wanted to go and be able to play tennis 1 to 2 nights a week and not pull his calf every time. And after a few weeks of just doing some easy progressions, which is much, you know, it's the same thing a strength coach does in terms of your kind of GPP phase plyometric. That's all we did, and he felt great after that. So again, it's hard to kind of have like that distinction between rehab and performance, depending on what the person's goal is.
Well, I think that's the right answer when you're doing your job correctly. You know what I mean? And
I appreciate that.
I'm probably gonna throw some people under the bus, and like that's not really my intention. You know what I mean? But I think that's probably a bigger issue, and you can probably speak on that. But like for an example is, we work with a lot of hockey players and even youth hockey players, and we had one of our players recently. I don't know to what extent, but had a severe enough hamstring pull that it was almost like an apophysitis. It was, you know what I mean? And he was sat down for like 4 to 6 weeks. And he's like, "Hey coach, like I'm cleared." And I said, "Awesome." I said, "Do you have anything from your PT? What have you been doing?" And he's like, "No. Like I'm cleared." I said, "Well, what was your return to play protocol?" 4 to 6 weeks of rest.
Right.
And then he went and played a game that weekend. And it blows my mind that we're allowing athletes or even weekend warriors or people to do things like this still, when I feel like we know better. I guess my question here is, like, I'm not trying to generalize all PTs or all ATCs or all strength coaches, but where's the disconnect here in getting these return to play protocols, even if it's just for a weekend warrior and an athlete?
I think a lot of that comes down to and that's why the performance coach, like your initial question, Jason, I think is so important, because it's like, as a sport coach, especially if you're programming for an athlete, like you're performing a needs analysis of what that person has to be able to do down the line, whether it's, whether they're in the middle of the season, whether they're in an off season, doesn't really matter what it is. Like, you're trying to understand like what they need to be able to do. And with what you're talking about, Ryan, it's when people don't understand like the stresses and the velocities and the speeds and the forces that people are going to be encountering in their sport, it's hard to kind of like start at that level and backtrack to currently where they are. And people, you backtrack to where they are because it's like, oh, they can't sprint right now. And then you go all the way down to like, well, it kind of hurts when they're walking around, so I'm just going to shut them down and do nothing. But then once you have them shut down and they no longer have pain during like normal day-to-day function, then there's no progression back to the level of sport that they actually have to be able to get to. Because again, I think people don't understand how to progress from like what's easier than walking. It's like, how about some double leg plyometrics? What's a little bit harder than that? How about skipping? What's harder than that? How about some single leg plyometrics? Okay, what's harder than that? How about a hill sprint? Okay, or whatever your progression is, just being able to kind of grade the stresses and have graded exposure back to the level of what they need to be able to do. So what happens is people get comfortable in day-to-day function without testing it out, if you will, and getting back to what they are going to actually be able to have to do on the court or on the field. Like for myself, I pulled my hamstring like all the time from my junior year of high school through I finished playing college football. Like every preseason I pulled my hamstring, and I would pull it like multiple times because that's what it was. It was like you would get a soft tissue injury, you would rest, you would go on the bike, you would jog a little bit, and then it's like, well, that's good. Like now we'll go back on the field and try to go full speed. But it's like I hadn't experienced like 50%, 60%, 70%, 80%, 90%. Like you have to experience, I think, all of the levels, whether it's for a short time or for a long period of time, before you're actually able to withstand the stresses that you're going to have on the field.
I think something that's interesting right now is looking at all the injuries in the NFL after all of these players haven't practiced with their teams, and who knows really what they've been doing. And it's like, what's the best way to prevent hamstring strains is, you sprint and you follow a good sprint program. And I think the phrase "do no harm," when people hear that, they almost take it to the side of where you have to almost be too easy on the athlete, where I think it almost has to go the other way. You have to challenge them in the positions that they need to be in. You need to challenge, their strength. You need to challenge single leg strength. And can you just kind of talk about the concept of do no harm and how that kind of plays into what you do? And I know it kind of goes in along with what you said already.
Yeah, I mean, the do no harm like phrase is obviously something we're all kind of striving to follow all the time. Like nobody wants an athlete to get hurt, especially like on their watch. Like I would say within the individual training session, like do no harm is 100% my number one goal, right? Like I don't want to like do something that's basically like don't do something that's irresponsible that's going to get them hurt. You have to understand their current fitness level and what they can handle right now and then progress it from there. But you're totally right that I think the do no harm things just means like don't let them have pain and don't get them too uncomfortable so we don't push them that hard. Because it's the same example of what Ryan just talked about. It's like if you have somebody who has had a hamstring injury and then hasn't done anything for 4 to 6 weeks and then gets back on the field, correct, you did not do any harm to them during that 4 to 6 weeks. So like, that's good. But did you really do your job and prepare them to be able to get back on the field and be safe and not have a high risk of re-injury? And in that case, like definitely not, because you didn't prepare them adequately for the stresses that they're going to be having to deal with in the sport. So yeah, like do no harm to me just means like don't be irresponsible. One of the things that we talked about recently was, it's like you watch somebody like for me, the stuff that I do from a return to play standpoint with my athletes probably looks crazy to like some PTs who their discharge testing is just like a 3-leg hop, or sorry, a single leg triple hop test. But we're doing like open skill reactive things, change of, actual agility drills that may look risky, but it's not risky. It's not risky if you've had the appropriate progression to those activities. And, like that balance of risk reward with whatever intervention we're choosing is always on our mind with everything that we choose during a session and like throughout the progression of care for a client or an athlete. But like what a later stage activity has low risk, high reward at that point in time. But if we chose that same activity and used it 3 months earlier, it's probably high risk, low reward at that point in time. So as the person adapts to what we're doing and they're becoming more competent and we're building the physical qualities that they need for the stuff that we're going to do later on, like the risk reward flips and things become less risky and we get more reward. But we're ultimately pushing them to be able to handle the stress of what they're going to be able to do in sport. Because again, we don't want to harm them, but if we're not putting them in positions that are stressful and at least challenging them and to getting them to be able to get them prepared for the sport, then we're really not adequately preparing them. Then like what doesn't care about doing harm is like the sport and your opponents. Like your opponents don't care if they're doing harm to you. So if we're not preparing them to be able to handle some of that, then we're probably not doing a good enough job.
And you mentioned kind of rehearse versus reactive drills, and that's going to kind of lead me into my next question. And Ryan and I actually had this conversation today, and we're kind of talking about our model of speed and power development, and we consider speed training to be an actual skill, and we consider linking movement patterns to be like our end goal, and we want people to do that well. And then we look at the movement patterns and we see like, all right, do they have the ability to do this well? And then, you kind of give them the drill. And in the case of even like physical therapy or even as we're training athletes, it's almost like a corrective exercise to get them where they want to go. Mm-hmm. So at what point do you go from kind of the rehearse drill to the reactive drill? Is it like when they are, I don't know a better term for this, but like a good mover, like they hit some check marks and then you kind of go into that stuff? Or do you kind of introduce just some very low level reactive stuff, just like, on my clap, do this or something like that?
Yeah, I think your last statement there is exactly kind of personally what I do with people is, always making sure that they have like the requisite physiologic qualities beforehand, like they're strong enough, they have enough elasticity, they have enough just work capacity and fitness before we're doing things that are kind of harder, like rehearsed drills. But even as I'm doing rehearsed drills, like I will always kind of be pairing that with some sort of reactive component to it, but I'm just going to limit how much of that chaotic open skill stuff I'm kind of doing with them. So even with like a rehearsed drill, like I'll have them just emphasize some sort of reactive component, because how they move reactively is always different versus not, right? Like change of direction and agility are two different things, because agility has that cognitive component to it where they can't predict what they're going to do and they can't pre-plan how they're going to navigate like these cone setup that we have. So I'll do like I said, like go on my clapper or something like that. If I think it's a really easy way just to start introducing a reactive component where they're kind of getting out of their own head about what they're going to be doing next. And as you said, as they become whatever your criteria is for like good enough at those skills, then again, the next progression is increasing the complexity of it. Increasing the complexity of it and taking away some of the constraints that they're dealing with during these drills. So I think closed drills are a great way to get people, again, from a coach's standpoint too, it helps us know what we're looking for. So I think that's a great way to kind of begin to train your coach's eye in terms of doing closed drills allows us to know that like, okay, they're going to do a hip turn at this point in time, right? They're going to do a rotational cut here. They're going to do a lateral cut here. So we can kind of predict what's going to happen and see if what the athlete does matches our model of movement in our head, which allows us to kind of have an intervention. But once they kind of meet that model of movement with these closed drills, then we can start making it more reactive and seeing how they are actually moving from a strategy standpoint where they can't predetermine what they're going to do. Because athletes, when they predetermine what they're going to do, when they know the path, they're going to move differently than they do in an open skill kind of actual agility where they're reacting to some sort of stimulus.
Yeah, absolutely. Right. And I think part of what you're saying there is like with the closed drills also is it's a great way for us to coach. I don't know, I'm going to use this term again, skill, right? So we know what it should look like, right? We know what we want it to look like. And then we can kind of sit back and watch that. It's like a curved treadmill. So instead of having them run 40, 50 yards down the field, we're right there being able to see this drill in real time. And we have an idea. And, you know, I know Jason uses a lot of closed drills and has really good success with that, leading them to that open drill, right? Using it as a way to teach motor learning also, right?
Mm-hmm.
Yes, they are going to move differently when they know and they don't know. We start to kind of blend those together and get bits and pieces of that and slowly, you know, open it up and let them go.
Yeah, I totally agree. I think, you know, like the closed drills are great for the predictability of it from a coaching standpoint. Like, you know, like how many cuts you're going to get off of a right leg versus a left leg. You're really like in a good way kind of constricting what the athlete can actually do. You're controlling, you know, by having your cones only 3 yards apart versus 8. Like at 3 yards, you know, they're not going to be able to be getting to the same velocities that they would if they were going to 8 yards. So there's so many things that we can control and manipulate to keep the intensity and the intent very high with closed drills. While you said still practicing skills, because I agree. I think like all of the movement patterns that athletes do in sports, like those are skills, and closed loop rehearsed drills are a great way to practice those skills. But ultimately we have to be able to get them to do that in a reactive situation to have it actually become, like I said, from like a motor learning standpoint, to have that become more innate and more natural for them, if that is an issue for them in the first place. And I say that because most athletes, when you have them, if they're doing some sort of reactive open loop drill right away, they're going to do a lot of the things right. But closed drills help them kind of fine tune certain things if that's what needs to be done.
I want to bring up something that just drives me crazy, and it is the footwear of kids that come into the gym now.
Oh yeah.
So, you know, we've had kids actually like sit down and be like, buy a pair of like these sneakers, you know, like court shoes or something like that.
Mm-hmm.
So I'm curious how you kind of address that or work around that, because I know like if someone's sliding all over the place in their shoe and they have, you know, a very kind of like almost like a sock on their foot, it's going to change the way they move a little bit. So how do you kind of figure out like, all right, are they doing that because that's what's natural to them? Or are they doing that because otherwise they'd be running on the side of their shoe?
Yeah, I mean, the shoe thing is 100% right. Like so many kids, I talk to kids about that all the time. If they come in for a session and, you know, we have to do plyometrics or we have to do some sort of change of direction agility stuff, and they're wearing like some of those like running shoes that, like you said, are socks, and they have like 3 inches of foam on the bottom, and they're just slipping and sliding, and you see their foot like try to stop, but then it kind of just like rolls off the side of the shoe. I honestly, like, I won't do, if I see somebody in those shoes, like, I honestly just won't do some of the stuff that I was intending to do that day. Because I know, like, for me, again, from a risk reward standpoint, I'm like, the kid might roll their ankle if they're going at an intensity that's high enough, and I'm trying to have them do a really hard, like, rotational cut or something like that. So I might just skip those things and then spend more time on like linear activities, because where there's just less demand from a frontal and transverse plane standpoint. But yeah, like, I always ask kids, it's like, do you have a pair of like basketball shoes, or do you have like soccer turf shoes that you play in, or do you have the sport of tennis shoes or something like that? And I'll have those kids just bring those in, because yeah, there's just like certain things I just will not have people do during a session with me if they're just not wearing the appropriate footwear. Like, that's kind of stupid, I think, to a certain degree. Maybe it's a little bit extreme on my part. But I think it really can make a big difference in terms of how somebody's going to be interacting with the ground. If they're in, again, 3 inches of foam that they can't really, there's no stiffness, and they're just not getting the rebound from the ground that they normally would in just a better pair of sneaks.
Oh, for sure. And I hate, like you said, kind of going into a session and then changing what I'm doing because I don't want them to roll their ankle. But then at the same time, I'm like, I'm not preparing them like I want to prepare them, and I hate it that something like sneakers can have an effect like that. It makes a huge
difference.
But it really does.
I have a very serious sneaker obsession, and I have like of 90s basketball sneakers and Jordans and all sorts of stuff. But then I'm constantly kind of buying like different sneakers to test out. So I have like 4 different pairs of like tennis sneakers, like tennis shoes at our gym in Jersey, that like, if a kid's going to fit in them, I'll be like, yeah, put these on. Like, I'm not having you, run around in those frees that, don't even have shoelaces. It's like, we're just not doing that today.
Right. And it even goes back to your point earlier of like an open close drill. They're going to move different. So it's almost hard for you to even coach what ability are they lacking, because you don't know, because they're moving differently, because they can feel that they're going to roll their ankle, or they can feel that, they're slipping and sliding. So it's like the injury part, but then it doesn't even allow you to properly assess what their actual ability is in a movement pattern.
Yeah, for sure. It's like, you're not going to get the effect that you're looking for. It's like, why am I going to do this thing with you if I know we're not going to get the effect that I'm intending for? It's like, we'll just do something else that's maybe going to have a better bang for our buck this day.
I did want to talk about gait patterns, and I've kind of heard other people, and really I don't know enough about gait to say whether this is true or not, but ultimately, like, your gait is what leads to like the best movement. And unless like you're taking care of your feet and your feet are working properly, like nothing up the chain is going to work. Do you think that's true, or do you think it's kind of like if your hips don't move properly or the way they should, then it's going to affect like downstream, or you think it's just like both?
I would say it's definitely both. Like, straight up, like, I think anytime people make a blanket statement like, oh, it's always the hip affecting the knee and the foot, or always the foot affecting the knee and the hip, it's like, we have no idea. Like, if we're being totally honest, like, we have no idea. And people are just kind of saying blanket statements because it sounds good and it's good for social media and all that kind of stuff. But again, like, I've seen cases with both. I've seen people where their foot affects their hip and their knee, and their hip affects down the chain, because biomechanically, like, for us, what we always teach is like proximal orientation dictates distal performance. So it's like, if somebody's in a really hard, like, anterior pelvic tilt or extension pattern, or whatever word you want to use, doesn't matter. It's like, they're going to be, orientation wise, it puts their feet into pronation. It puts more weight kind of on their toes. So it changes how their foot's interacting with the ground. I think for myself, what I always coach, especially when it comes to like the agility and change of direction stuff, is I just coach balance. I want people being able to have relatively equal contact, kind of heel to toe. Because if somebody's up on their toe, they have less surface area, they're going to be more unstable. Their center of mass is pushed forward. They're not going to be able to find as good of a push-off angle. Like, there's all these kind of things that happen when you get somebody starting off in a really bad position. So I always want people to feel kind of balanced on their feet. If we're doing something more lateral, I want people to be able to feel that inside edge of their foot, because that typically orients their knee into a better position relative to their foot and their hip to move laterally. But yeah, like kind of to answer the first part of the question, like the hip definitely can affect down the chain and the foot up the chain. And, you know, we rarely do things without footwear, meaning like we rarely do things that are of high intensity without footwear. Like if you're sprinting without shoes, like you're not really sprinting. Like you're not going to go at the same velocity that you normally would if you were wearing shoes. If you're doing change of direction stuff barefoot, like you're not going to go in, you're going to move differently barefoot than you would without it. So I do some stuff with shoes off or socks off, just so I can kind of get an idea of like how somebody's trying to move. Like, are they always trying to keep their heel off the ground? Do they excessively like slap their feet into the floor? Can they not control pronation? Just to get an understanding of like how they're moving. Another thing that I do see a lot is you'll see people that instead of being able to get like authentic dorsiflexion kind of coming from like the talus rolling in the ankle, you'll see them kind of get a lot more like low ankle toe extensors kicking on. So they get like their toes to flail up. That's a little hard for me to say. Toes to flail up to kind of clear the foot from the ground rather than getting the actual talus kind of moving into true authentic dorsiflexion. So those are people that like, they have a ton of calf tone. They have a ton of like, their foot's kind of overly supinated typically, and their toes are flailed vertically as they kind of come up into a jump. So they're not getting dorsiflexion occurring at the ankle. They're doing this compensatory kind of motion at the toe. So I think there is definitely value in getting people's shoes off and kind of assessing how they move, but I don't think there's any place to like have if you're trying to get like the best quality of speed or change of direction or agility, probably not going to get the best thing with having it done without shoes on. I don't know if that answers
I've heard Lauren Landau talk about that exact thing with the foot that you had just mentioned. And, you know, I know he goes through like as soon as someone sees him, their shoes are off and he's kind of looking at their foot to see like how it's even capable of moving.
Yeah.
Are there certain things within the foot that you're like, this is what I don't want to say like a good athlete versus a bad athlete, but I don't really know a better term, but something that you always see from better athletes in terms of their feet versus someone who is probably like not as explosive?
I would say, again, with like a generalization, I would say no. Like I've seen people with like one of the best athletes that I work with, like has complete like flippers for his feet, but still has like actual good like ankle dorsiflexion range of motion, still has great knee and hip mobility. Like the kid just moves super, super well. So I think people can kind of compensate like in and out of everything. I think the hard part is determining like if that is the limiting factor, because it's so easy for us to find something that is quote unquote like non-optimal or not ideal and try to say like fixing this one thing is going to cause this cascade of events and everything to get better. That's just rarely the case. But yeah, like I think when it comes to the feet stuff, sometimes it's like, again, trying to determine like, is that the limiting factor? Is it low functioning or is it dysfunctional? Like that's a term Lee uses that I love, that I think really just makes that kind of concept like hit home. It's like, just because something is limited doesn't mean it's dysfunctional. Just because you like somebody could not have a lot of ankle dorsiflexion, but that doesn't mean that they're dysfunctional. Like they could just be low functioning. They could just not have great ankle dorsiflexion. And then we can do something to improve that range of motion. If it's like truly dysfunctional, then maybe they should go into PT. And even for us, if something's like truly, truly dysfunctional, like then we send it off to an orthopedic surgeon or something. If there's something actually structurally wrong that's causing these limitations.
Yeah, no, that's great. And so for us, we do a lot of, I would say early warm up, 3 to 5 minutes with no shoes on. We started, we'll do slant board and have them do different angles and get up on the inside of the edge, onto the ball of foot, low level plyos, maybe progress from double to single. And we've had a lot of success with this, but I do wonder how much is it because of our clientele. We see a lot of swimmers and we see a lot of hockey players. And part of the reason we do so much of that is our hockey players always being in that hockey skate, and they're very limited and kind of locked down. And we do a lot of change of direction and speed work in the off season. So we need to prepare them to do what we're going to ask them to do. And we find that like at first we were doing a lot of shin splints and ankle injuries. And once we started taking that time to just kind of let them move freely without a shoe on and kind of build up some strength. And then even with our swimmers, and I think it might have to do with them always being in the water and having that kind of plantar flexion and like, you know, with no gravity, that even they had a lot of success just doing basic holds without a shoe on. So I do wonder if a lot of that for us, our success has just come from who we're seeing.
I would say the success with that just comes from good programming. You know, that's the kind of stuff that I love to do with my athletes too. I think like those lower intensity, you know, up to moderate volume, low amplitude plyometrics barefoot are huge for people, especially because people like a shoe can make your foot interact differently with the ground. Like an example of that is like when I work with a runner who, if they have like a really bad heel strike, and a super easy way to get them to not heel strike is to have them I'll have them do tempo runs on the turf without their shoes on, because you're not going to jam your heel into the ground if you don't have 2 inches of foam, you know, protecting your heel. So all of a sudden their overstride is completely changed just because of how they're kind of trying to interact with the ground. So, and I think that also helps them, you know, the intrinsic foot muscles just get a little bit more adaptation and their stress a little bit more. And I think there is definitely huge upside to doing some of those easier activities barefoot just to get people moving differently. I think so much from the PT side that we do is just, we're trying to expose people to the things that they don't normally do. We always talk about variability, and we're trying to like increase the different things that they can do and just give them more variability, which doesn't necessarily need to be like any one specific thing. It's like we're doing a bunch of different things that are just different than what they do. So like, for example, when we see like powerlifters, it's like, we're not always like working on their squat. Sometimes it's like, let's throw in some different accessory work like split squats, because you just don't ever split squat. It just changes up the loading pattern a little bit and makes them move slightly differently, and can just give them a little bit, you know, stresses them in different ways than what their traditional, what their sport does, or what they kind of typically do on their own.
Right. No, I think that kind of aligns with our model. So at the top of our model is performance. And then it kind of branches off into a broad focus and a narrow focus. And that narrow focus is when a client comes in and they have expectations of what a training session is going to be, we have to somewhat meet those needs, right? And then we also then look at like what sports, you know, take some fitness testing or like some KPIs, and where do we need to kind of get better? That's like our narrow focus, right? And then our broad focus is just long-term athletic development. And that's where a lot of this barefoot stuff comes in for kind of warm up, is we're going to try to expose them to as much as we possibly can. And then especially early on with them, we're going to expose them as much as we can of things that they definitely don't do, right? So again, I'll go back to hockey. We're going to do as much posterior chain work as we can when we first see them. You know what I mean? And I think just having that model, and then once we kind of get through that model, then it kind of meets back up with more of our principles based in force production, velocity, and then movement quality, right?
Yeah, I'm like you know, me, Greg, and Doug kind of talk about this stuff. Like, we got to like make them human first. Like, let's give them just the human capabilities that they should be able to do, like covering all of the basic movement patterns of squat, hip down and knee down, whatever words you want to use, push, pull, vertical, horizontal, carry, anti-rotation, just getting people to be able to do kind of all the things with a relative competence. Because I think that's huge. It's like you see young athletes who are being trained like they're older athletes, and they don't have even close to the foundation that those older athletes do, and they're doing like, you know, like VBT or something, when it's like that kid can't, or they're you know, doing like an Olympic lift, and it's like the kid can't do a 20 kilo kettlebell deadlift. It's like, why are we doing that kind of stuff? Like he has so much other stuff he should be able to do just as like a young athlete that I'm not even going to worry about some of that other stuff yet. It's like, why are we having somebody sprint if they can't like appropriately skip and march and hop and do some of those just basic things that are the foundation for those higher level activities.
Right, so that kind of goes back
go ahead,
to
Ryan.
like, no, sorry, I was gonna say that kind of just plays into exactly what we were talking about with someone the other day is like so much of this, especially early on, is just all motor learning, right? You'd be surprised at how much you can get by asking them to skip and, you know what I mean, basic pulls, whatever you want to call it, hip hinge, all that, like the basic stuff. And again, I don't think it has to go back to as far as it was where people were, you know, maybe getting too far down physical therapy loophole as performance coaches, right? I don't think we need to go that far back. And we don't need to have these young kids training like they're pros either. And I think you're right on point with what you're saying.
I really like what you just said there too, of like going too far down away from like what they kind of need to be able to do. Like that's something that I think we're seeing a lot more of as people are trying to like differentiate themselves like in the industry, whether it is more like the rehab side or more the performance side. You see people that like try to get it down to like this one root cause of what's going on, that if you fix this one itty bitty tiny thing, like you're going to see these dramatic changes in performance. But it's like, if like, when you think about training, it's always about like the SAID principle, right? It's like, you have to do what you want to get better at. You have to do something that is that thing or something pretty close to it to get better at it. So it's like, you know, if somebody, we always kind of go back to like our orthopedic range of motion test. That's our baseline assessment for pretty much everybody that walks in the door for us. And it's like, if somebody doesn't have some of those normal ranges of motion, whether it's, you know, like hip internal rotation or hip extension or whatever, like we're going to get them those ranges of motion. But then I can't expect like, just because somebody's hip extension range of motion improved, that like they're going to run 2/10 faster when they go in, you know, on their 40-yard dash, if they haven't like done a sprint progression, or if they haven't done something that's like actually going to get them better at what they need to be able to do. Like, yes, maybe from a variability standpoint, giving them more of those ranges of motion and the requisites that they need is super important. And we want to do that stuff. But ultimately, like if we just then let them be left to their own devices and we're not coaching them, then that's the kind of like what you're saying of like, you go too far down the PT rabbit hole where you're doing stuff that's like too low level and you're not really causing any sort of adaptation. It's more of a motor learning standpoint, which is huge. And motor learning is super important, but ultimately like that's part of strength training is motor learning, but then it's also like getting stronger. It's also skill acquisition. There's so many pieces that kind of go into it. And when we take like one little thing that we think is going to change the whole system, it's like, if the system was that sensitive, that'd be a bad thing. That'd be a terrible thing if like one little intervention completely changed the entire system. The person was that fragile that like one little intervention was just going to like completely change how they perform. Like that would be a terrible, terrible thing. So I think when people kind of preach that that's what they're doing, it's like, if we take a step back, that's not a good thing at all.
I always think of progressions in terms of, instead of always getting harder or getting easier, it just has to be different. You know, you can just take a hop, and instead of just, you know, hopping forward, you hop to the side, or instead of hopping to the side, you hop at an angle. You know, it's not making it harder, it's just making it different. And I think, especially when we talk about long-term athletic development, that has to kind of be the idea. And then once you kind of maxed out all of those, then go into the next progression.
Yeah, absolutely. I think like, you know, like variation is necessary for adaptation, right? Like you're gonna get used to the same type of stimulus all the time, and then it's no longer gonna cause you to adapt. So you got to vary it up, and like simple things like that, just changing the angles, changing the directions, changing, you know, like left, right, or some, you know what I mean? Just some sort of little tweak can be enough that it challenges the person, whether it's, even if it's not necessarily physiologically, but it's challenging them cognitively to kind of figure out how to do the task. I think there's huge value in that, of just like these little mix-ups. And honestly, like from a coaching standpoint, like it keeps things fun for us. Like it's boring trying to coach the exact same thing all the time. Like you're still giving them the same type of stimulus that we're looking for, but like it's fun. It's fun coaching something new, and it's fun trying to see somebody trying to do something that's new. That's not like too far off from what you've already been doing, where you're just kind of changing what the stimulus they're actually receiving is.
Right. And you're kind of building a movement library for them also.
For sure.
Right. Because as we get into sport and we talk reaction and we talk a lot about this, a lot of times if you're thinking, it's already too late. Right.
For sure.
Like it's already happened. So exposing these athletes, and again, I'm saying athletes, it could be anyone, but exposing people to as many different scenarios as possible. And they're building up that memory bank and their body's like, oh, I've seen this before, or we've been here before. And they don't have to necessarily slow down and think about it. They can just move through it, I think is a huge key that I think people sometimes miss when they're building a program and they get worried too much about too much variety because they want to get really good at one thing. I think there needs to be some, and we don't have to, like you said, you don't have to travel too far off that path, but just a little bit each way, I think plays dividends in the end.
I would, I think that idea is like super important, especially for like kind of like what I think kind of we're all referring to is like the more of like the actual movement type of stuff, like giving the variation with that is super important, and it does kind of create that library that you're talking about. But then it's like, then you see people who like are kind of almost doing that sometimes with like the strength standpoint of things, where it's like every week it's like a different strength routine. It's like, well, that's not actually going to get you stronger. Like, I'm sorry, if you're, it's like trap bar deadlifting and then changing up to a different type of hinge pattern and then another one the next week. It's like, you're not going to be getting good enough from a skill standpoint to be able to perform that competently. And you're not going to be able to like really get them stronger if strength is the goal with that activity. So it's like, there's a time and a place for sticking with it and just being kind of giving people the same thing over and over and over. And there's also a time, like especially with like low level plyometrics, I think there's a great place to introduce variation and create that movement literacy especially for younger kids and even like older athletes who are so used to just doing the same thing over and over and being so stuck in like the type of movements they're doing in their sport all the time. Like getting people just to do different things, it has so much value.
I'm gonna ask a question about something kind of totally different here, but I think Lee had mentioned that you did it. Now, it's something I have no experience in, but I'm always super curious about: blood flow restriction training. Is that something you've done?
Yes. Yeah. So we do blood flow restriction training at our spot in Jersey. It's awesome. Like I think there's so much value in it from a like especially. So typically, like it's used with somebody who's post-op, who's post-surgical, who like needs to maintain strength. It's a great way to like decrease the amount of atrophy that they're incurring. So what it does is basically like cuts off oxygen from getting to whatever tissue you're kind of, basically it's either like at your shoulder or it's at the top of your thigh. So it cuts down off oxygen to the rest of the limb. So you create a hypoxic environment to kind of stimulate the type 2 fibers that are actually like your strength fibers versus your type 1 fibers, which are obviously like, based or use oxygen. So it's a great way to, when somebody can't actually strength train and can't stimulate those type of strength fibers, if you will, it's a great way to stimulate those fibers without having the mechanical load because they can't actually do it. So like we use it a ton with people who are coming off of a surgery, but then I'll also use it with people who come in if they're like, just their legs are trashed from a hard workout or something like that. It's a great way to, I keep saying great way, it's really useful to help them kind of recover because, again, you're not sore from BFR, which is one of the cool things about it because you're not doing anything that's actually heavy and truly stressful on your body. You just get a really good autonomic response to it that kind of can help stimulate healing without having the stress from heavy lifting.
That's super interesting. Something, I've always kind of wanted to try, but never, did it. And I never, had something around my leg or anything like that. Yeah.
If you guys ever come up to Jersey, we'll try it. It's fun. I always tell people, I always give people like a little pep talk before we do, because I'm like, it's super uncomfortable. So like, get ready for that. I always tell them it feels like when you're in sports and you're doing like a bunch of suicides or gassers or something, and your coach is, pissed off at you because everybody messed up at practice and he's just having you run like nonstop, where your legs feel like they're about to explode and they're so swollen and they can't move, and like, but your lungs feel the same way. So you kind of get that same feeling with the legs, but not the lungs. So the strength protocol is 30 reps of whatever exercise, a 30-second break, 15 reps, 30-second break, 15 reps, 30-second break, 15 reps. So people always think like during that rest break, they're like, it's going to go away. Like, you stop squatting for 30 seconds, your legs like momentarily feel a little bit better before you squat again. But because there's no oxygen going to it, it just feels terrible, like kind of the entire time. But then once you take it off, it's like 30 seconds later, a minute later, you're like, oh, my legs feel incredible. So it's a really cool feeling. Like it almost seems like voodoo kind of at first, but then once you do it, it's like, oh yeah, I'm bought in.
So with that, does the equipment matter? Like, I know that there's some different name brands out there. I'm not sure what you use. The only one that I've heard of and I've had experience with is, I think, Be Strong. And or am I saying that wrong? And then
we use the Delphi unit, because that's when we bought it, and I don't know if that's changed since, that was the only like medically approved device. So like for us, like we have to use the medically approved device. I have no idea about like some of the ones that you see, online, people just the little tourniquets themselves. Like ours actually have like a real blood pressure cuff that basically when you put it on, you turn it on and it finds the person's blood pressure. So it only includes up to a certain percentage. So for your upper body, it only includes up to 50%. For your lower body, it includes up to 80%, because you don't want to over occlude somebody for too long, because you can, kind of do some pretty serious damage. But yeah, so the ones that we use are like the medically approved device. It's the Delphi unit. It's the ones that Owen's recovery system is the course that we took, and I recommend it for like anybody that's interested in it, whether you're a strength coach or a PT, or like a rehab professional. It's a great course. They do a great job of kind of going into the physiology behind it, much more than I kind of just did in this little rant. But yeah, it's super useful, and I definitely recommend it like, even if you're not going to buy the units, it's kind of a really useful tool to kind of understand what it does and understand the physiology behind like why it works.
Now, my wife's a PT, Ryan's wife's an ATC. So if an athlete comes to us with an injury, we always say, go see the professional. But the reality is some of them say, I don't want to do that. And I'm not going to do that. I'm going to rehab with you guys. All right. So if, we're seeing like hamstring strains, ankle sprains, just simple stuff like that, what would your advice be to a strength coach that is kind of in charge of like rehabbing, even if they've said, go see the professional, but the kid still comes in?
I think that's, like if trainers and strength coaches and, I would just say fitness professionals in general, always had to refer out every single time they had a client complain of like some sort of like ache or pain. It's like you would never see anybody ever, right? Like people always have kind of something going on usually, so that's almost like unrealistic. But again, I think that a concept of like low functioning versus dysfunctional comes to play in this kind of scenario. It's like, can you determine that what's going on is like a low functioning issue, or is it a dysfunctional issue? Like if they, like an ankle sprain, yeah, it's not a big deal. It's like you're gonna like progress them appropriately with different plyometrics and understanding like how you're going to be stressing the ankle to get it back to what it needs to be able to do eventually. It's the same thing with like a hamstring strain. It's like, I would say it's almost hard for me to answer that question because I am a PT. I'm like, yeah, I don't know what I'm like, send them to PT. But I totally get that like kids sometimes like, nah, dude, like I don't care. I almost think like the answer is kind of convincing them that if they really do need to go to PT, convincing them that like you can still train and you can still do stuff. Like I think that's one of the reasons we have a great rapport with like the coaches and trainers that refer clients to us, is that like we never tell people to stop training. Like we rarely tell people to completely shut down and stop doing whatever. It's like we will find a way for you to be able to modify things to be able to continue to do what you want to do. So I think like hopefully trying to educate them on that was almost kind of would be your best case scenario if they are really like hell bent on like not going to PT, but they actually do need it.
It's funny. Earlier this summer, like as soon as we opened, there was a kid, and he was like 4 months post-op ACL, and his dad's like, "No, trust me, it's good." And we had to send him away. But it's like, what are you doing? You
Right.
know,
What?
you still have
Yeah,
range of motion issues. You're
totally.
clearly not even walking right. You know, so
Yeah,
Just
it's
limping in on his first day, right? You just
right.
limping
Like
in, and I'm like,
that's a different, like that's a completely different scenario that than like, somebody having a hamstring issue or like an ankle. It's like, yeah, whatever. Like it's probably gonna get okay if they're doing things that are appropriate and they're not just, doing something that's actually irresponsible at the current moment. But that kind of stuff happens all the time where whether it's the PT didn't adequately prepare them, or they've been discharged when they probably shouldn't have been discharged, or maybe they ran out of insurance visits, or there's so many different reasons that those kind of things happen, which is super, super unfortunate for the client. And it puts the coaches in a tough scenario, because it's like, one of the things that we talk about is like understanding your skill set. It's like, if you don't have, and this is not like a knock on anybody, but it's like, if you don't have the skill set to be able to deal with somebody who is coming in limping, coming in with range of motion issues and all that kind of stuff, it's like, yeah, you're probably not the one to be preparing them. And it's like the same thing from a PT standpoint. Like, just because you are the medical person and you've gotten somebody the range of motion, they have like, decent, they have limited asymmetry and, kind of the typical PT check marks, doesn't mean that like, how to get them ready to return to sport. So like, they should then be sent to a strength performance professional like yourself. So it's like, there's this in between zone that, who's kind of handling the care from that typical discharge from PT, which is like 3 to 4 months when you should have your full range of motion and all that kind of stuff, to whatever the timeline is to actually get back on the field. It's like, who's kind of handling that bubble, because that's what happens is like, though they're not ready for strength and conditioning, they're not ready to for actual good training yet, but they get sent to somebody like you. And it's like, if you don't have the model to be able to do it, like maybe that person needs one-on-one care, and it's just, your model doesn't allow you to provide that. Like, that's a tough situation for coaches to be in. So I always feel bad when that kind of stuff happens to coaches, because it's like something somewhere in this line of communication, whether it was, the doctor, the ATC, the physical therapist, whatever it was, like something was miscommunicated, and the person is not ready for whatever somebody thinks that they're ready for.
right. And I just think there's so much pressure for these young athletes to perform, right, and like get back and play, and and like we're talking like long-term athletic development. Like, no one cares if you're the best 12-year-old, right?
No.
But that mindset is out there, and that's a hard mindset to break. And even like 14, 15, 16, I'm trying to explain to them, like, don't rush this. You don't want this to follow you, you know what I mean, for the next few years.
Right.
It's just hard because there's just so much pressure. I think they put on themselves, but maybe from parents, from coaches, from scouts, from whatever, that they feel like they just want to bypass it. And as soon as it's like, yeah, you're cleared, right, even though they may not be clear to the extent they think they are.
Right.
It's just go, right?
Yeah, I think that's the hard part of like athletics and kind of the new world, where everybody is playing sports 12 months out of the year. They don't really have an off season, and they don't really get time to be a kid and just kind of, like enjoy the sport. It's like, if you're 12 years old, and this does happen, it's like you're 12 years old and you're rushing back for a game or something, it's like something is like out of whack. Like, the priorities are just kind of mixed up. It's like, you should be having fun. You should be feeling good. You shouldn't be battling through injuries as a 12-year-old. It's like, take some time off, enjoy life, like go ride a bike, go throw a ball around the backyard with your friends. And it's like, that should be part of your rehab then, is just like being a kid again, rather than making things so regimented for these young athletes. And that kind of, I think that kind of goes for everybody. It's like, the rushing back to be competitive right away. It's like, there's a time and a place that's absolutely the case. Like, I have an athlete who she was coming off an ACL and is trying to get back for her senior year of soccer. She's not planning on playing in college, but she's like, I am playing my senior year. And it's like, cool. Like, would I want more time? Absolutely. But I'm going to do everything I possibly can to make sure she's confident and can be competitive on the field when she gets back to her sport. So it's like, there's a time and a place to kind of push things, but then you have to know when to like reassess the entire situation and be like, yeah, we don't need to, get Tommy back on the field for his, 12U baseball game this weekend.
I think it's great what you're doing, what Doug and Greg are also doing with Resilient. What is next for you guys as a group, and kind of the model you have where you are blending this like therapy and also performance side to it, and then also just for yourself personally?
For us, it's growing the practice more. Like we have 2 locations, so we're in Manhattan and then we're also in Chatham, New Jersey, and we had just signed a lease for our new space in Manhattan right before the quarantine kind of hit and stuff. So the timing of that wasn't necessarily ideal, but we're back on the other side and doing well again. So it's really trying to grow like the clinical side of things and continue just to help more people in the areas that we are in Manhattan and in New Jersey. But also from an education standpoint, like we love talking with other professionals and just sharing what we do with people. We want to be as open and honest and authentic as we possibly can and share like the things that we actually do. Because there's so many discussions about like theories and the best way to do this and the best way to do that. But without like sharing case studies or like what it is you actually do on a day-to-day basis. So we're trying to create education, content that is kind of biased towards that of like no frills, like this is truly honest. This is how we practice. This is how we assess. This is how we coach. This is how we kind of look at things and just share what we do, because I think having that kind of honesty and that openness is kind of great for the profession, because I think there's a lot of like infighting between people that's just completely unnecessary and trying to like look like I'm smarter than you and all that kind of stuff, that's another topic that just kind of irritates me. But like just trying to create more education content that's authentic and real. And it's like, not saying that this is the best way to do things. This is how we do things. And like take it or leave it, like no issue, but we just want to share what is that we do. So personally, one of the things that I'm doing is I'm creating a course creating our next online course, which is going to be on return to sport with a focus on acceleration and agility, and just going through how we progress somebody from low level plyometrics into actual agility drills, like we were kind of talking about here.
That's awesome. So where can people like find out about, I guess, where can people reach you? What's your website? Can you just give that info?
So if you go to resilientperformance.com, we have our first course online, actually, which is Resilient Movement Foundations. And we actually wanted to say we have a 10% off promo code for people who listen to this podcast. If they just put in the promo code podcast, you'll get 10% off of that course. And that's our introductory course. That's just kind of like a general strength and conditioning, like how do we coach basic movements? How do we want basic movements to look like? And then we're always reachable on social media. @ResilientPPT is our handle on pretty much everything. Personally, my email is trevor@resilientperformance.com. So again, I love talking to people and kind of sharing what we do. So if anybody has questions, like feel free to reach out. And I'm always happy to hop on a call or do a Zoom or do something, kind of get to know people and hear about what you do and share what we do.
Awesome. Well, thank you so much for coming on.
Yeah, thanks for having me, guys. I really appreciate it. This is fun.
Awesome. Thanks, Trevor.
Take care.
As a thank you for listening, we'd like to offer a 10% discount on all products at resilientperformance.com. Please use promo code PODCAST at checkout. That's PODCAST. And I also encourage you to sign up for our mailing list to receive exclusive articles only available by signing up. Thanks for listening.